Happy Valentine's Day, everyone. It is Friday, February 14th, and it's all about flowers. It's all about teddy bears. It's all about chocolate and candy hearts. But did you know that Canyon Vista Medical Center is the heartbeat of healthcare in our community? And that's what we're here to talk about because February is National Heart Health Month. And we have some heart health experts that we get to talk to today about all of this. Fawn, it's good to see you.
Good to see you.
Use the microphone. There we go.
Good to
that
see
helps
you.
too.
Thanks
that
for
helps
coming
too
in.
to be able to talk in that. I know it's weird. We're holding it everywhere, but it's so good to see you. Thank you so much for talking to us about this. Let's talk about February. February is all about, it's the month of love. Love is in the air, and love is about the heart. But there's something very special about the heart. First of all, what do you do here at Canyon Vista Medical Center?
I am the chest pain coordinator here at Canyon Vista Medical Center. Okay, I get accreditation. It's a national recognition, coast to coast, from the American College of Cardiology. We often say the ACC, but for those of you that don't like acronyms, that's what it is.
That's awesome. And what kind of facts can you just throw at us about heart health or things that maybe we need to recognize about our hearts?
Well, according to the Cochise County Health Department and the surveys that they put out and the information that they gather to update every 3 years, cardiovascular disease is one of the top 4 problems that we face here in Cochise County. And it's pretty much a national problem coast to coast.
And knowing that it's so high up there, it's important for us to make sure that we have proper checkups and make sure we're seeing our physicians.
Correct.
And healthcare providers.
Correct. That is absolutely correct.
What do you see with cardiovascular conditions that are they preventable?
A lot of them are preventable. Of course, everyone knows about cholesterol levels and blood pressure checks and eating a healthy diet and exercising. And that is a very important part of it. It may or may not prevent you from having heart issues. The genetics play a big part in it as well. But your lifestyle is at least 50% of the problem. So maybe if you're going to have a heart attack, if you've spent the last 30 or 40 years eating healthy, exercising, and taking care, you're going to do a lot less damage to your heart if and when an incident occurs, if you do get a blockage in a coronary vessel or a heart attack. So.
And think about that. Speaking of which, where are we, by the way, here in the hospital?
This room is one of our testing rooms. It's the treadmill room. If we suspect that maybe your heart, and we've got a treadmill here, if you're suspecting that your heart is having issues, that we will hook you up to the treadmill. We'll hook you up to an EKG that shows what's going on with the electrical activity in your heart and shows up on here. If you're on this treadmill and you're working out and you start having chest pain or you start having shortness of breath, we're going to see it here on your EKG, and then we'll stop the test and see where we go from then.
And be able to notice it. And that's where we started this video, actually, was by looking at the anatomy of the heart. It is an amazing muscle that kind of keeps us all going.
Correct.
It is the ticker here. But Fawn, your job is to be in the chest pain center, right?
Correct.
And what is the chest pain center, and how does a hospital become one?
Oh, okay. To become accredited, there's a lot of data you need to collect, a lot of benchmarks that you need to hit, a lot of goals that you need to work for, and these are the same goals that every hospital that's accredited has to go through. For example, we like to have, if you're having a heart attack, we call it a STEMI. If you're having a heart attack, we have a goal of, from the time you reach the ED door to the time you get your stent in that blood vessel to open it back up is 90 minutes. That's our benchmark. We want to hit that 90 minutes. We have all kinds of timed things.
Well, because beyond 90, then there could be major consequences, correct?
Time is muscle.
Yeah.
The longer you go not delivering oxygen to your heart muscle, the more damage your heart muscle undergoes. So we have different benchmarks. We have times for our staff, what time they have to be there. If your heart attack is at 2 in the morning, you have 30 minutes to be here dressed and have your hands on the patient in the cath lab to have it all set up. So we have all these benchmarks that we have to meet. And if we don't meet them, then I have to answer for that. Why? What went wrong? What can we do better next time? So we're constantly reviewing the data that I spend hours collecting, constantly reviewing what we've done right, what we've done wrong, and trying to make improvements if we can get better, and making sure what we're doing good doesn't slip back.
Wow. Could you repeat all that while on the treadmill?
I
I'm
could.
kidding. That's okay. You don't have to do that. We do have someone else here to be able to talk to us as well, and I'll take this, and we'll say hi to Joe. Hey, Joe, introduce yourself again, because thank you for letting us see you again and hang out with you. Go ahead.
Hi, I'm Joe Clifton. I'm Director of Physician Services for Canyon Vista Medical Center, and I oversee the Sierra Vista Medical Group.
And happy Valentine's Day.
Happy Valentine's.
Heart Health. We all got our stickers on. Thanks to Fawn making sure that we're wearing our stickers today. But let's talk about the future of cardiac care here in our community at Canyon Vista Medical Center. What are we on the forefront of, and how is Canyon Vista Medical Center continuing to be the heartbeat of healthcare in our community?
So Canyon Vista is heavily investing in the community and trying to keep care local. So our biggest project and our biggest goal for the coming years is the construction of a cardiac cath lab. We currently have one, but we'd like to build an additional 2 units in the hospital that would be able to serve the community and be able to see more patients in a faster amount of time. In conjunction with that, we're also looking to expand cardiac services in the outpatient. We're looking at a general cardiologist we've been trying to recruit to help Dr. Fahad and Dr. Cohen, and we're looking to expand the clinics as well to allow more opportunity for people to come in and get cardiac services. And that's, for me, that's a big thing for, I have a vested interest in that because I just got diagnosed with high blood pressure. So, it's important to have a good primary care services. We have Dr. Molina, and he's always taking care of me, Dr. Fahad and Dr. Cohen as well. So it's important to be able to have accessibility, and that's what we really want, for our communities, accessibility, outpatient and inpatient.
And thinking about that, looking at National Heart Month, which is what February is all month long, that's about the future that you were talking about of Canyon Vista Medical Center. What about the present? Talk to me about this lady over here.
She is a wonderful lady. She forgot her lipstick today, but she is full of facts. But I can
and the rest of the staff as well that work with the chest pain center.
So I will let her talk more about the chest pain center because that's her baby.
I want you to talk about what it means to have that here.
What it means to have it here.
Yeah.
What it means to have it here is it's an assurance. It's kind of like a safety net in the community. You know that if you need the service, that it's there. Yeah. And that security is really what people want to know is, can I go to Canyon Vista, and if I do have a heart attack, am I going to get there in time? Are they going to be able to treat me in time? Am I going to live through this? Or is my loved one going to live through this? And when you're in a community, that's really what you want to know is, is this a community where if something happens, I'll be taken care of? And we can't rely on sending everything to Tucson. We have to build it here for our community. And, that's one of the goals that Sean's had and we all had and we all share, and that's what we're working towards.
And again, the present and future of heart health is right here at the heartbeat of healthcare in our community at Canyon Vista Medical Center. Come on back in, Fawn. As we wrap up here, thank you guys so much for watching this video, and for all of your heart health needs and so much more, you can turn to the heart health experts in the Chest Pain Center and all around Canyon Vista Medical Center here in Sierra Vista. We're so grateful for them allowing us to come in today and record this video, and next time I'll make sure that I get on the treadmill and have all the things all stitched up to me. And I bet you would. No, that would be so much fun and absolutely amazing. But thank you guys for all you do here in our community. Happy Valentine's Day. Happy Heart Health Month. And thank you to Natoya for setting this up. And thank you for watching. Thank you for sharing and letting people know of the amazing services in the A-rated hospital. If it's still the only A-rated hospital in Southern Arizona, right here at Canyon Vista Medical Center, the heartbeat of healthcare in our community. Have a wonderful Valentine's Day, everyone. Thank you so much for watching. Thank you for sharing. And remember, if you are in an emergency, a health emergency, please dial 911 immediately. And then hopefully we'll take you here, because this is going to be the place to see these amazing folks, the amazing physicians, nurses, staff, waiting to help you and your family in any emergency, in any crisis. They are here 24/7, and we're grateful for them. Have a great day, everybody. We'll talk to you soon.
Bye.
Awesome.
Thank you.
Awesome. Thank you.
Good job.